Thank you for joining our webinar. Last week, we recorded a conversation between Eric Surwell, Director of IT for VIP Community Health Center, and Grayson Kelso, Director of Data at Hillsides, and are presenting that conversation to you today. At the conclusion of the pre-recorded portion of our presentation, Eric and Grayson will be available live to answer any questions from attendees. Please post your questions using the Q&A button at the bottom of your Zoom meeting box. With that, we will begin our presentation.
Thank you for joining us today for a conversation with VIP's Eric Surwell and Hillsides' Grayson Kelso. Today, we're going to have a conversation with them about why they chose CareLogic in Los Angeles County. And our Senior Solutions Consultant, Jesse Widener, will be moderating today. I'm Heather Rudolph, and I'm the Regional Sales Manager for Qualifacts Credible here in California. And you've probably received voicemails or emails from myself or Jacob Hassan. He's our business development partner here in California with me. And our main goal is to get the message out that we are an option in LA County. So with that, I will turn it over to Jesse to introduce himself and our panelists today.
All right, thank you very much, Heather. Thanks for being with us all today, everybody. My name's Jesse Widener, Senior Solutions Consultant with Qualifacts Credible. And as Heather mentioned, with me today, I've got Eric Surwell from VIP, and I have Grayson Kelso from Hillsides as well, both Los Angeles County organizations that recently decided to take the plunge with CareLogic. I was involved in both of your evaluations. I actually was able to offer the initial product demonstrations for both of you. And so I got to learn a little bit about your businesses and sort of what you hoped to accomplish with a new system like CareLogic. But I did have just a few questions, to get your thoughts on, mainly kind of how your implementation is going and some of the benefits that you've seen thus far from CareLogic. So I think the first thing I'd like to know is, with CareLogic being a relatively new product in the LA market, what is your kind of best 30-second pitch or elevator pitch as to why you chose to take that plunge and go with a newcomer? And Eric, I guess we can start with you.
Great. To be perfectly honest, the main reason we were going with a new system is we wanted to get away from our old system. Our old system had really bad user design, user experience was poor, and we weren't really confident in the other solutions that were all currently available in Los Angeles. And when we were contacted by Qualifacts, we looked into Qualifacts, felt like they would be able to develop the system to connect to the various county services they need to connect to. So we took the chance, and it's worked out great, actually.
That's good to hear. And Grayson, what about yourself? Just your kind of 30-second pitch.
Yeah, we've been on our previous system for just about 10 years, and as time kind of went on, our needs changed, and I think we really started to adopt approach of it's clinicians first. Clinicians are the ones that are working with our consumers day in and day out, and this platform needs to best support their workflows, their processes, and everything that they need to do. And so I think for us, looking at the CareLogic offering was all about that one-stop shop. Integrations, allowing them to get into one system, do what they need to do, and get out and support their consumers.
Sure. Well, thanks for that feedback. I wanted to talk a little bit about the actual implementation process. Grayson, you had said that you were on your older system for 10 years. Eric, I know it had been at least 5 years that you were on your previous system before you decided to make that change. I just wanted to talk a little bit about the implementation process. Eric, VIP recently went live with CareLogic and completed the implementation process. Being sort of the guinea pig, for lack of a better word, talk a little bit about your experience during the implementation process and kind of how you were able to work with our team, to ultimately get you across the finish line and live on a new system.
Our process, honestly, was more of a development process at first, right? There is a significant number of services you have to connect to with your electronic health record for it to work well in county. There are, in fact, I think 6 endpoints. There was a lot of work to do for that. We initially met with your VIP of implementation as well as your senior analyst, who, by the way, is amazing. And they got this information from us and then basically developed each and every endpoint and also consulted with our QA/QI director, Allison Foster, and worked out what the process was in county as well. They call it here, they call it the clinical loop. You guys call it the golden thread. Anyway, and so as that process completed, frankly, our implementation was quick and simple compared to the development process. The development process took some time and a lot of work inside the agency. But we, to be fair, wanted to be the agency you worked with first so that we could really help design that process. One of the most important things is, as Grayson's pointed out, is we needed the system and the process to support the clinicians throughout the clinical loop. I didn't need the clinicians to have the level of friction they had with the previous system where they had to hop around to get their jobs done. And your system, as developed, it's turned out great. And it was actually very rewarding for us to be part of that because we were able to see the final product and also really to put in conversations about future optimizations. So we actually had a great, and we also had a great team. Probably one of the best trainers I'd ever seen. We actually had an excellent time with the implementation process once the development was completed.
Well, that's fantastic to hear. Yeah, Grayson, you were going to say something. I don't want to cut you off.
Yeah, sorry. Excuse me.
Yeah, I just want to echo, Eric's sentiment on all of the individuals and the teams at Qualifacts Credible. We're obviously a little ways behind where VIP is with them, implementing and going live. But I think, everything that we've seen, everything that we've experienced thus far, the team's been knowledgeable, organized, and I think most importantly, responsive. I'm definitely the one that's going to throw out the what ifs and the theoreticals of certain situations and things like that. And, I think the most warming aspect has been that the responses that we've received have been open and honest. And, it's a lot easier for us to hear, yes, that's the right way to kind of go about that, or no, that's probably not the best way to go about that because of this reason. That really helps us better implement for our end users. And I think even in those areas where it's maybe been, we've had additional questions or haven't really gotten a perfect idea of how we want to implement it, the Qualifacts Credible team has been very quick to say, hey, do you want to jump on a call with this solutions expert? Do you want to jump on, maybe a demo, or do you want to see how another organization has done something that we feel is similar? And all of that has been so useful and powerful for us and, my team in implementing this new system.
So I did want to ask you both about the implementation process. I know you both are kind of at different phases of that. Eric, your group having recently gone live, and Grayson, your group, maybe a couple months into the implementation process. And Eric, you alluded to some of the development work that needed to take place as part of your implementation. Were there any challenges associated with that? I mean, I know you said our team was responsive and good to work with, but were there any challenges in kind of being the first to implement a new solution like this in the county?
Sure. I mean, the real challenge is, dealing with LA County assets. There's a specific way they do things and they don't accept any other way. And in fact, that's exactly how they started the meeting. When we got into our initial meeting, they're like, hey, so we have a way of doing this. We understand this may be frustrating to you, and that's the way it is. That was literally how they presented it to us. That being said, they were very responsive, but there's often a lot of back and forth. Again, with 6 separate APIs essentially to hit up against, there's a lot of back and forth. Hey, did this go? Did this not go? The IBHIS stuff with the various, contextual changes in that EDI billing file, that can be very challenging and I'm sure is something that, by the way, county changes on a regular basis. So as we were developing, they changed the structure of these files as we were developing. So then we'd have to play catch up. So there was a lot of that rigmarole. But now, like I said, any of the services that have been established have been working fine. And like I said, as we've now implemented, it's been working great. So
that's good to hear. And Grayson, I know, I mean, your group gets to take advantage of the of the development work and that connection to the LA County, already being there. So that's a positive. I guess kind of where you sit at the, I guess, relatively towards the beginning of your implementation process. What about anticipated challenges on your end? How do you see that going, and potentially things you could run up against?
Yeah, I think, definitely a kudos and a thank you to Eric and his team, because they're effectively the guinea pigs, and we just get to enjoy the fruits of their labor.
Yeah.
But I think for us the biggest challenge is when we decided to move forward and start implementation, we gave ourselves a pretty stringent, tight window to get it done. I had the ambition to kind of go live with CareLogic on July 1, which is start of our fiscal year, and really have a very clean cutoff. So I kind of set the bar high with our internal folks. And, I think that kind of the challenge in doing that, aside from just timing and having available staff to kind of give their 2 cents, is our folks are excited. They want to provide that feedback. They want to get in to the system. They want to see how they can do certain things. And as great as that sometimes can be, it's also something that's a challenge when you're on a very tight deadline. So for us, it's really kind of balancing our priorities of what we need to kind of have stood up come July 1. And then, what are the things that we can kind of wait or push down a little further post go live, so that we have a very seamless integration across the board for us.
Sure, that's helpful. And that actually leads me to kind of a follow-up on that, Grayson. A new implementation is you can think of it essentially as a fresh slate to think about, really workflow optimization, staff experience. You mentioned you wanted your clinical folks to be the ones really kind of driving this and really being the ones that, you're making sure are happy with the new system. How are you, I guess, personally, and how broader kind of, how is Hillsides looking at merging, your current processes, things that might already be in place, with some of the new tools or capabilities that are now available to you or will be available to you with a system like CareLogic?
I think the framework that my team has really taken in this implementation and kind of looking towards the future and CareLogic as our solution is automation. I had mentioned earlier, the one-stop shop. And that's kind of bringing everything, under one house, one umbrella for our folks. But that next step, that next evolution, to me, is really about automation, automating those workflows. CareLogic provides clinical decision rules, business rules. Forms have branching and more advanced conditional logic, point of entry workflows, to name a few. But I think it's mostly going to be about integrating our staff throughout their clinical process and allowing things to just kind of occur behind the scenes in the system. And I know that Eric's individuals, all of his folks, they kind of really spent a lot of time engineering the IBHIS piece and working on that, so that it is a more automated, it is a more fluid process in the system. Because as he mentioned, LA County likes to change things. They change things. We have to kind of adopt and adapt very quickly to that. And so I think the more and more we can abstract a lot of that stuff from our end users, our clinical folks, and just allow them to do those things that we want them to do, it just makes the entire process so much smoother across the board.
Yeah, I got to agree with that. And key to that is, the idea that I don't need my clinicians stopping work to manage some physical part of the process. And sadly, many of the other offerings in LA weren't able to keep up with that, whereas your product did and does. And it really lets us, like he said, they just keep treating patients. That's what I need my clinicians doing, treating patients, not managing unwieldy systems. So this is actually, and again, doing this design work with you guys, every single possibility for an automatic form upload or an audio, anything where automation could be put into place, we advocated for. Like, well, I mean, hold on, we would stop and say, There's a way to do this automatically. Can we please do this automatically? That being, and for us, really, it was to free up our supervisors to do more supervisory work around the clinical process versus administrative work around getting the numbers right. And that's where your product is simply, well, frankly, blown our old system out of the water and allowed the supervisors, and it's very confronting now for them to, their game now is to really support the clinicians with their clinical development, with their client, and with their client health and their client process down the line. Getting clients served quicker is, I think, one of the things that county wants done. They're not looking for a 2-year process. They want more of a 6, 8, 9 month process. This helps with that because, again, so much of the administrative work is now offloaded onto the system.
And so I got to ask, Eric, have you been able to collect sort of any initial feedback, from whether it's from your clinical staff or from your supervisory teams? How has that automation, you talked about how that's freed them up to actually, take on some new duties or some new kind of strategic goals. But what's some of that initial feedback been? I mean, how have they been liking it?
Well, so one of the things we did is when we had when we were gathering the group of people together that were going to be the trainers, right? The trainer group, right? The trainers of that. We actually picked people who were, our power users, highly, technically skilled, not uncomfortable with computers, and also good in the EHR that we had. And we also picked less technically able users, but people that still had a passion for applying, their skills to the assistance to children, right? Like we needed them to have passion for clinical work, but maybe not as technically, able. And the truth is, top to bottom, there's been great excitement. A good example, one of the areas where it just absolutely excels is in the area of doing group notes, group setup, group management. It's really reduced it to about 1/10 of what it took. And so all the group clinicians are absolutely ecstatic over that because groups are now no longer a painful process for them to set up and collaborate in. But since we went live January 11th, honestly, we're still getting used to the system. The users, I mean, they're basically having to learn a whole new system, and they're still learning. And so there's still some discomfort with it. Also, to be fair, when you enforce a process in a new system, well, the users often have to learn parts of that process. And so what we're getting is users who are now getting used to that process that they may have been skipping parts of before. So to be clear, for administrators, what I'm telling you is this essentially enforces the specific process you want in the clinical loop. There's no ways to get in and out of the system to get around those or to develop shortcuts, which is often, look, clinical users will get their job done no matter what. That's the poor or the sad part of a clinical user is they'll work with a broken system and make it work, and you'll never know about it sometimes as the infrastructure person. So, we experienced that with the old EHR. This system has, again, not only enforced, but really shown us what needs to be done in that process. And again, many of the users are frankly learning some of that process. In about 3 months, we're going to do some KPI, some measurements. What are on some KPIs? How quick is point of entry, which by the way, much quicker. How quick is the initial assessment? Now let's go through a client treatment plan. Let's go through, and we're going to do each one, count it in the old system, and then count it in the new system, count clicks, count time, and see what the real difference is. We haven't done that yet. We're waiting until 90 days at least.
Yeah, concrete data. Very nice. Thanks for that. Well, I did want to ask, we've kind of talked about the implementation, some of the benefits, some of the challenges. If I could get just from each of you really kind of your best elevator pitch, if you will, or your 30 seconds on, really why, each of you coming from different, prior products for several years, what really was the driving force and why did you make that leap with a newcomer in the county, a new product? We'll start with Eric, just, 30 seconds on why CareLogic.
Again, I think what it was is look, I would sit in our QA/QI, our now administrative director's office, and we'd sit and complain about our old EHR, the ways in which it didn't work well for us, all this mess. When we were contacted by Qualifacts, one of the things that's key here is, and I think I may have mentioned this, I didn't have a high level of confidence in the other offerings in LA County beyond our EHR. So when Qualifacts started contacting us, we did a little bit of a dive to see how big the company was, who they served, what the current clients were. And I believed that with the company at the size of yours, really 100 developers, right, that you should be able to do this process. And then after several, interviews with you guys and conversations, we went ahead and took the pledge based on really trust in how it was presented to us. The response, look, in LA County, your responsiveness is off the charts. There's no comparison, right? Like, it could take me days to get a hold of people at the other company. Meanwhile, I can call people up at your company on their cell that's on the implementation team. And that's a whole nother level of reality here in this county. That's why we went with Qualifacts, because they were willing to provide service that just wasn't available in the county before.
Thank you, Eric. And Grayson, what about yourself?
Yeah, I mean, it's about our users, and I think the more and more that we sat in on our our clinical program meetings, and we got feedback, we realized that we needed a system that was more catered towards the things that they need and the things that they need often. And I think one of the areas that really kind of blew me away with Qualifacts Credible is the integrations that are available. There are so many different layers of integrations that you can have in your system. And for us, we built so many kind of offshoot integrations that kind of connected to our old system. We had a separate dashboarding product, a separate reporting product, and it was very convoluted for our staff, right? It's, you have to go here for this, you have to go there for that. And it's just not simple for them, and it wasn't intuitive for them. And so I think now, as we are kind of bringing all of that under this one umbrella, not only is it saving me and my team time, and we're reducing all of that overhead, but we're increasing our efficiency to not only deliver, but also support our end users. It's a one-stop shop. It's all there. It's available to them. Things like the patient portal, the patient messaging, built-in, custom reporting. I mean, that's huge for us. The ability to write a report, get it out to our users, and then say a month later, say, hey, you know what? We need to add something else to it. We forgot this, or things have changed. That very quick and easy ability to do that and deliver real-time data is really just a massive lift, not just for my team, but for our clinical leadership, all the way down to our direct users, our clinicians that are out in the field. And they want to know what their current productivity is. They want to know what's outstanding in their case records. All that stuff being in one simple solution is really kind of the pinnacle for us. So
yeah. Right, and let me piggyback on that. To be fair, I've been involved on and off with this agency here since 2002. The holy grail has been a level of reporting that would allow us to get even to yesterday, like whatever happened, wherever we were at yesterday, with all of the reporting that we needed done. And to be fair, when it comes to, a good example would be when it comes to our activities reporting, we would have to run 3 or 4 reports, combine, sort to get what we needed. And it might take our billing people a couple, 3 hours to do if that's all they had to do. Now there's a reporting system that will sort billed versus total approved based on funding source, all right there, and our billing supervisor just runs it. It went from a 2, 3, 4 hour process to a 5-minute process, and that's just one of several gained efficiencies just within the reporting system. And so, really, that thing that everybody wanted, is there in your product, and pretty easy right now. And to be fair, we haven't even really gone down the road with the more refined reporting, which we'll start looking into again in about another 60 days. We're going to actually be doing several custom reports, and I know Grayson is too, so I'll be asking him for his. But anyways, you get my point, is that we haven't even really cracked the surface but we're already experiencing, this lift in productivity because, we're not spending time doing reports, modifying reports, minutes to units, all that mess that your system does just straight out of the box.
Yeah, that's exciting to hear. Guys, I think it would be probably fair to say that some folks listening to us today are maybe in a similar situation as you were, kind of looking at evaluating potential new solutions. I would just ask for, any words of wisdom to your colleagues out there who are looking to, potentially make a switch, cautionary tales, words of advice, things that you wish you had known, maybe jumping in. And we could start with Grayson on this one, just sort of anything that you would like to convey to folks who are potentially looking at switching.
Yeah, I think the most important thing, obviously, defining your requirements and really vetting that across, all competitors in the space. I think that goes without saying, but I think the big shift for us that I really just want to kind of hone in on is the last time we went through the evaluation process of an EHR, the market was not as mature, I think, as it is now. And so many of the systems we were looking at was really kind of, do they have everything that we need, right? It was absolute requirement. It wasn't that they have everything and more. And I think now that's the piece that if you're looking at another system or even just thinking about it, what's that and more look like to you? What does that mean to you? What's the future that you want to deliver to your, not just your staff, your users, but even your clients, thinking through the Cures Act, thinking through patient portal, thinking through all of that other external functioning and how that's going to integrate. I think that's really where you need to kind of shift your attention and your focus, and not just about, can it do this as we've been doing it? Think about that next step, that next evolution of a platform.
And Eric, what would be your advice to someone, kind of listening to us talk here and wondering, gee, could I make that type of switch? Do I have, what it takes to take on a new implementation and to implement a new system?
Well, I mean, I think that the efficiencies and the sort of experience, the user experience that this product's going to provide to your clinicians really answers the question within the realm of Qualifacts, the product CareLogic, because any of the pain you're really going to gain back in the end on gained efficiencies. That being said, the biggest thing I think agencies should look at, and it really isn't solved by any of the EHRs, is data retention from your old EHR. You got to think about that on the way out. And you likely should speak with them early and often, because unfortunately, until the Cures Act final rules are ratified, there's no government regulation in the space for the protection of this patient information beyond, well, there is none, right? So EHRs will practice what's called information blocking, and not only not make the retrieval of this information from their systems easy, but they'll charge you a monthly fee to access it. And in LA County, we have to hold some data for 20 years or more, right? So the reality is what I'm waiting for, and what you should consider is, how are you going to be good custodians of that patient data that you're responsible for? And right now, it's you as an agency that are going to have to take it on the chin to deal with all of the issues. That being said, hopefully, when the Cures Act is and that's actually another thing, when the Cures Act is finally ratified, you got to ask yourself a question: does your current EHR company have the staff to comply? Because that new rules for the EHRs is a heavy lift. It's a lot. And that means that you should be able to transfer all your patients from your EHR over to the new EHR within 3 years at the click of a button. And that's a big thing. So that's a consideration. When Grayson brought up the Cures Act, that's a consideration. Will your EHR even be able to comply?
Sure.
It's possible that they won't. So for me, the biggest consideration that I would warn anybody is retention and custodial duties towards that patient data that you have.
Eric and I are definitely going to be working together to really kind of broaden the LA County sphere of functioning and making it simpler across the board. And it could be things as simple as, I create a DMH form that comes out and I can share it with Eric, right? And vice versa. We don't have to both develop the same type of stuff if we're both going to be required to use it with the county, for example. You know, if I develop a custom report that I think, hey, this would be great for VIP's billing team, why not? You know, share it with them. We need to be able to share more knowledge because by extension, it's going to impact and it's really going to help, I think, the broader focus of treating clients in LA County specifically. You know, if we can start to eliminate all the question marks of systems and EHRs and the data and just deliver back to the people making change in the community, that's going to be most important. And I think Eric and I are on the same page in kind of doing that. And, you know, we want more folks to kind of get involved and help us in that, you know, that goal of nirvana, so to speak.
Yeah, I got to agree. That is a total difference with your product in that your product encourages like collaboration with the users. There are other products in LA County, they hide who else has their system. It's like literally topsy-turvy. So I really appreciate it as well.
Well, yeah, I want to thank you both for our conversation today. I mean, Grayson, I think, you know, you mentioned the community, and then Eric, you kind of expanded on that idea of community. And I would just like to close by thanking you both for your time today. I think you've offered a lot of insight, you know, for folks listening today. And I would like to say that I personally am excited to have both of you as a part of the larger CareLogic community, and more specifically our Los Angeles County community. And I look forward to, you know, kind of continuing to follow you both on your journeys with CareLogic. So thank you again and appreciate the time.
Thank you so much.
Thank you.
And thank you, Jesse, Eric, and Grayson. And thank you to our audience for your attention during the pre-recorded version of our presentation today. I am Heather Rudolph, and I am the Regional Sales Manager in California for Qualifacts. Give me 1 second. There are a number of questions that have come in, so I'm going to give me 1 second to we're trying to get our live portion up here, and then I will review the questions and begin answering them. I can already tell you from the number of questions that we have, I probably will not get to them all. So I will try to get to the most pressing ones. Grayson, can you unmute yourself and make sure I can hear you? Okay,
Hey.
There we go, great. And Eric, you wanna also unmute yourself because at least we can have, okay, and Jesse. Okay.
Hello.
Okay, great, thank you. And Tiffany, if you're working on cameras, that would be great so they can see our lovely faces. But we'll go ahead and proceed. Thank you all for your attention today. It was really great. And thank you, Jesse, Eric, and Grayson. Good information for everybody, including me. I'm going to start with a couple questions on functionality because a number of people asked a couple of common questions. One is about forms and reports. So when you have changes to forms and reports, who can do those? How does that process work?
Well, I can speak to it now if you like me to. First off, your staff can create new forms and reports. They also, CareLogic Qualifacts will also create forms and reports for you. Depending on the size of the job, generally they'll just do it. Sometimes, you know, if there's going to be more complex things, there's an hourly charge for it. But we haven't found that yet. And in fact, all of the county forms in LA, at least, they've worked with us to create them. Not only with us, but we've been able to make adjustments as we wanted to as well.
Thanks, Eric. And that's really addressing kind of the forms that are required by the county. And I know Grayson touched on the form functionality and the fact that we have gating and branching and all of that. Grayson, you want to talk about a little bit how you're going to be using the form functions in CareLogic?
Sure. So, I'm sure like many other orgs out there, we obviously have the county compliant forms, the required ones, but we also have many, internal forms. Some things that are for our personal accreditation, other things that are maybe for internal tracking, outcomes analysis that we have. So I think the really cool thing that was new for us is not just the ability to create custom forms, but the way that you can attach those forms elsewhere in the system. So yes, you can have a custom form built, you can design that, you can have branching and conditional logic, and you can actually have business rules within that form on top of all that. But you're not just limited to just doing that form as that form. You can actually attach it to, certain types of session notes. So you can have a session note template for, an individual psychotherapy, and then you can actually embed other forms against that simultaneously, and have all that be done at the same time by the clinician. You can also then, make that form applicable in other workflows, and then you can also stitch together multiple forms into kind of a larger like form grouping or larger kind of compliance document that you want them to kind of have to hash out, all in one sitting, not just, on that session note. So I think the flexibility, it's exponential, and I think it's opened up a lot of new pathways for workflows for us as an organization.
Great, thank you, Grayson. I think that definitely covered forms. They had a similar question about reports. And I know, Eric, I know you talked about reporting, and I know you've had some direct experience with some of the reports you've tried to create as you went live. If you want to talk a little bit about kind of the reporting in CareLogic, that would be great.
Yeah, and in the video we touched on that, but beyond that, if depending on, of course, what level of reporting you purchase, we purchase the full system. There is an entire report designer that there's also quite good training on. So it's not even that you have to have knowledge of SQL or other items, but we've been able already to start creating forms that are specific to the agency, specific to how we want certain programs to perform. And it's been working well for us. Again, we're still in the expansion process of our implementation, creating all of the custom forms that we had in our old add-on system we used with our old EHR. That's the position we're in now. And what's great is the older reporting system we had was much more difficult to use than the newer reporting system. And I mean, we were even considering having to hire an additional employee to do the new reports. And in the end, we didn't have to do that because the reporting functionality with your report designer has been easy enough for our QA and billing departments to work with directly.
Great, thank you, Eric. Grayson, did you want to say anything on that?
I think the only thing is just to kind of give a framework or an update to anyone else that has maybe very much gone down, an analytics, data analytics perspective. We internally have custom reporting solutions, we have dashboarding, all that lives kind of outside of our current EHR. And so, moving that in, Eric mentioned the custom reporting functionality, but on top of that, you can also leverage dashboards. So if you think about kind of that duality, you can build very, tabulated reports and things like that. But then for those, maybe less comfortable users that maybe aren't too familiar with tabular models and things like that, you can build simple dashboards, so productivity dashboards, missing paperwork dashboards, all that stuff can be integrated and kind of right in the face of your clinicians. So they don't have to leave, they don't have to go and run a report. It can just kind of be exposed and available to them.
Right, yeah, I mean, to piggyback on that, we've already implemented clinician dashboards. We've already implemented supervisor dashboards for the review and management of the information they're supposed to be handling. And as Grayson said, it's been quite simple, much simpler than our other EHR, but also immediately effective and able to be used by not only the clinicians, but their supervisors. So it's working well.
Great, thank you both. And our cameras are working, so if you'd like to turn your camera on, that'd be fabulous. They can see your lovely faces. Hello. All right. Okay, great. Thank you for the responses on forms and reports. A couple other questions have come in while we're going. Is it easy to do? What kind of technical knowledge do you need? And basically what I've heard from users is that it is fairly simple to create drag and drop reports and to work on the forms tool in the system. You don't need to be a programmer to do it. I see Grayson nodding and so is Eric, so I'm saying the truth here. Some other questions that have come in along those lines is, does our system use PDFs? No, we don't. We use the forms builders and things like that, and then we can create, you can create a custom visual of that form, or we have a standard form that will print. I'm trying to go fast, so Jesse and anybody else, if I say anything that's not correct, stop me there. I'm trying to cover a lot of topics here quickly. Okay, I'll read through those while they answer a next set of questions kind of around end user adoption. So a couple of questions, I'll paraphrase, merge some together. How did you solicit feedback from the end users in terms of going through your selection process? So what kind of involvement did you have from end users? And it's kind of paired with another question that says, you know, internally their end users, even if they're not happy with the system, their end users are not willing at this time and place in life to take on a project like this. So how did you guys get around that? And was that decision really pushed from the end users to get a new system, or was it pushed from the executive team that now's the time, we can't wait any longer?
So I can,
Yeah, you go first.
I can start. Yeah, thanks, Eric. You know, so for us, I think for a while, it probably started with our end users, you know, echoing dissatisfaction, you know, little things, workflow, you know, the delays of maybe certain things in the system, the time it took to do certain things, or maybe just general frustration of, I don't know, or I don't remember how to do these very specific things. And I think, you know, over time that kind of builds up, and that kind of generates a motivation from, you know, upper management to start to look at, you know, is our current system really the solution for us? And, you know, as our internal goals as an organization are changing, are we matched with the right system to help us accomplish that? So for us, that's where we started. And then getting into kind of our requirements, it definitely took us a while. I mean, it took us a few months in knowing, you know, we wanted to start looking at systems and defining that list. But what worked very well for us is we got a large group of, you know, direct level staff that work directly with our consumers, all the way up to executives that maybe have never even logged into our EHR, but, you know, manage those levels of the organization. And we kind of just threw everything up on a wall. We basically put it into a nice template, and we had ongoing discussions about what that type of stuff would look like. How would a system implement these needs, these wants that we have? And then we posed those to the EHRs we then looked at. And the key for us was not to just design this requirements document and then sit in a demo and ask those questions in a smaller subset. We invited all of those clinical individuals, all of those other executives that were part of that requirements phase into those demo calls, because we want them to experience that organic, you know, visualization of, let's talk about this requirement. Oh, okay, here it is. This is what it would look like for us, you know, and then that gives them that feedback loop of, you know, that makes sense to us, that feels natural. Or maybe on some systems it didn't. Maybe it felt, you know, very much a workaround or not natural to how they would function as users.
For us, we were really coming from a sphere that there was so much, you know, interactive and cognitive friction with our old electronic health record that we were almost starting from almost like a bottom experience. And, you know, we showed the demo to many people in the agency. We had about 10% of our users review the demos, and we really had the almost universal answer of, well, does it actually work? If so, this looks great. Can we do it? And after, we also are blessed here with many of our directors and supervisors having been clinicians who had to use our old EHR when they were clinicians. And so everybody was able to see the benefit of the product. And then really it was our assessment, which was left upon management, mostly myself and the project manager of the process, Allison Foster. Do we really want to take this on as a risk? And we did. So that was how our process went, was how bad or what was the problem with it? We couldn't see any downside, you know, because it was already terrible. And really, in the end, it paid off for us. It's delivered. So.
Great, thanks, Eric. Let's see, scanning through the questions. Again, we don't use PDFs. I know that's an issue for some of you coming up. It's going to be a painful process to get off those PDFs in the near future. So a bunch of questions around other programs and counties. So does CareLogic work in other counties and with other programs? And can we bill Medicaid in other states? I'll answer that one. Yes, we can. We're in 42 or 46 states, something like that. So we're only in the state if we can do state reporting and bill to their, payers. So yes, we are. And then other counties and other programs. Grayson, I don't know that either of you are in multiple counties. Okay, so they're just in LA County. We are in multiple counties in California though. And then I know Grayson, part of your decision process was the ability to bring in other programs besides LA County into CareLogic. So maybe you could take that one.
Yeah, so we have our LA County contracts for mental health, and then we also have DCFS contract for family preservation in LA County, as well as a transitional age youth residential and peer drop-in center that we built out over the last couple of years, none of which is funded by the county. Some of that is via grants, LACSA, and private as well. And all of those layers are also moving into CareLogic for us as well. And we also have a commercial portion to our services on top of our LA County mental health. That's also going to be moved into CareLogic as well. So we have kind of a full gamut, I think, across different layers. That's not just mental health. That's all going to be under one roof.
Great, thank you. Eric, anything to add on that one?
Well, as we were the first ones in LA County, what I can attest to is that if they're not in your county and they go there, they have the staff and the capability to implement in your county. LA County is ridiculously complex, maybe overly so, and other counties may not be as complex or as difficult. And I can attest to the fact that when they come into a new county or a new area with new requirements, new workflows, that the product can be adapted to those workflows and requirements.
Thank you. I know you're a big fan of our integration team, so thank you.
I just want to say, yes, top flight integration team.
Okay, so on that topic, that's a nice segue into the next kind of set of questions, which is around support and development. So somebody asked what the support process is, and since both of you are pretty early in the implementation process, and Eric in the go live process, probably haven't. I know you haven't been turned over to support yet. We do have a whole process of implementation. The go live period is a time frame. It's not a day. And then the team works with them during that in-between period before they are technically certified on our system and able to go to support. So that's kind of how it works in theory. And I don't think either of these guys have really experienced that, but Eric probably has something to say about the whole team. But another person texted me a question, 100 developers, seriously?
Well, I mean, I'm pretty sure that's correct, right?
Yeah, it is correct. I think it's actually more. And our support system, our support structure is also broken out into tiers. So there's first level support, third level support. The experience of that team, is respective to the team that they're on. So you have very experienced people in that tier 3 support. And then you have the development team that's, beyond that. So we have a very deep bench in support, and we take customer satisfaction very seriously around here. We measure it, monitor it. We have dashboards for everything to kind of look at how support is going overall and in an individual customer perspective as well. Did you want to say anything on that, Eric, about support?
Yeah, I mean, it's funny because I've been in poor and in fact really bad. And I've been well, I'm not going to use a victim, but I've been involved in the very bad implementations as a customer. And this is not that. In fact, one key thing that you see with bad implementations is at the end, your communications tends to start to fade with the company. The responsiveness goes from maybe a couple hours to a day or two. it starts to go really bad at the end. With this company, you experience none of that, or at least we experienced none of that. And in fact, we're still fully engaged with the company. And I mean, it's not just one team. You have a billing team, you have a clinical services team, you have an overall conversation with your project manager. All of these happen weekly during the implementation. And in fact, now, even a month out, again, I know because we're the first in LA County, so there's extra stuff to look at and deal with, but we're still having all of those meetings and they're still working on the implementation. Any things that come up that aren't working as designed, they're fixing it. And I just want to go back to the overall development team. There are some top flight pros on that team. I was lucky in my career to have worked with Toyota in an implementation of a business-to-business system. And they're just as good as Toyota ever was. And I'm not saying Toyota was bad, I'm saying Toyota was excellent. And their analysts are as good as I've seen. So I had great support and I could, without hesitation, recommend them because they've shown up for us and continue to support us. And as I said, I can contact them whenever I need to. There's no wall. I can just get to them. If their email's not there, if their company phones, I can call their cell. So, the support here has been excellent for us.
Thank you, Eric. Grayson, any comments on that? I know you haven't gotten quite that far yet in your process.
Yeah, not quite, but we will be there shortly. I do think that the actual implementation and the project, I mean, I think something that was just so supportive and refreshing is we had a pre-project planning call that kind of went over the entire capacity of the project of implementation. What was to be expected, who we needed to have involved, when we needed to have them involved. All of that was so good to know before we then actually technically started the project, right? So I think it's little things like that that is clearly based on data, based on previous success and failures at Qualifacts Credible, bringing that in and then littering that in throughout the process. That just makes it so much easier for us to implement a system, especially in I mentioned it in the video, tight and strict deadlines that I've given myself and Hillsides. So,
and Qualifacts.
I want to piggyback on that. That's one key difference is oftentimes when I've done projects, I find myself having to drive the project, right? It was opposite. With them, they drive the project. They bring the paperwork, they bring the framework, they drive you into it. And that was refreshing.
Very good. Okay, I'm going to wrap it up with the Q&A took a full 30 minutes. I'm very, very excited about everybody's questions there. I think I covered everything on a general basis. I know there's some specific questions in here. I will get back to you on answers to those. And if you have any others, you know how to reach me. I'm sure you've got a few emails from myself, Jacob, phone calls, etc. So thank you for joining us. I'm asking one more question. Last question. Sorry, I almost got sidetracked there. The last question is on the merger. So we merged with Credible in August, and there's been a few questions from folks that went through similar mergers on other products where it hasn't been such a great experience. So they want to know, how has the merger affected you? And are you, worried about that going forward?
Well, for us, we actually signed your contract the month you guys did the merger, right? And really, it was like a 1 month bump where some staff shifted, and then that's been the maximum impact for us.
Okay, great. Grayson?
Yeah, I mean, I can pretty confidently say I didn't even really feel like there was a merger. I mean, we were obviously, notified and all that. And I think as a customer, it's really a positive step to be affiliated and have just signed on with a company that was already large and growing, merging with another company large and growing. I mean, that's like, the best of both worlds. But we have not really noticed any hiccups. Everyone has been very open and clear about everything going on, and I think that's really kind of helped us and reduced any anxieties that we may have given what other mergers sometimes can kind of look like and operate with.
Okay, thank you very much, Eric from VIP, Grayson from Hillsides, and Jesse from Qualifacts Credible, and all of you in our audience. Thank you for all you do. We appreciate everything you do. And you know how to reach us. Give us a call if you have any questions. Have a great day.